Hi, I'm Abbas Hassan, a postdoc fellow at the Department of Plastic Surgery at MD Anderson Cancer Center in Houston. On behalf of Dr. Butler and the other co-authors, I would like to thank JACS for the opportunity to share our research on the effect of wound contamination and outcomes of abdominal wall reconstruction using acellular matrix, a 14 years experience with more than 700 patients. Abdominal wall reconstruction in the presence of bacterial contamination is challenging, and previous studies demonstrated an increased risk of hernia recurrence, surgical site occurrences, and surgical site infections. Prior studies have demonstrated that the use of acellular matrix reduces mesh infection, explantation, and adhesion formation than synthetic mesh. Therefore, in the setting of contaminated defects, the Ventral Hernia Working Group recommended using ADM instead of synthetic mesh. In this study, we evaluated how increasing degrees of wound contamination affect abdominal wall reconstruction outcomes with ADM by comparing each of the distinct CDC wound classification. We conducted a retrospective cohort study assessing all consecutive patients who underwent abdominal wall reconstruction using ADM for repair of ventral hernias or oncological defects at MD Anderson Cancer Center between March 2005 and June 2019. The primary outcome measure was hernia recurrence. Secondary outcomes were SSOs and SSIs. We identified 725 abdominal wall reconstructions using ADM with a mean follow-up time of 42 months. 302 patients had clean defects. 322 patients had clean contaminated defects, and 101 had contaminated/dirty infected defects. Patients with contaminated/dirty infected defects were more likely to have medical comorbidities, preoperative abdominal wall radiation, larger defects, rectus muscle violation, parastoma hernia, and previous hernia repair, and were more likely to have undergone bridge repair. Patients with contaminated/dirty infected defects had a hernia recurrence rate of 20.8%, an SSI rate of 23.8%, and SSO rate of 54.5%. These patients also had higher rates of mesh exposure and removal, reoperation, transfer to the ICU, and 30-day readmission. Despite the higher contamination rates in this cohort, multivariate logistic regression demonstrated that contamination level was predictive of SSOs and SSI, but not of hernia recurrence. These findings suggest that ADM provides safe and long durable outcomes even as contamination level increases to contaminated, dirty, infected wounds. ADM should be strongly considered in cases of increased contamination. On behalf of myself, Dr. Butler, and the rest of the co-authors, thanks for listening and thanks for reading.